The country of Gambia now recalling Indian-made cough syrups that have been linked to the deaths of over 66 children. And in fact, Gambia has launched an urgent door-to-door campaign now. There are actually teams of people going out, knocking on doors to ask people if indeed they have either bought or been given these India-manufactured cough and cold syrups, and they're being asked to hand those over. The World Health Organization has linked these syrups with the deaths of 66 children. Now, this on a day when India's health ministry has said it's still awaiting some kind of written communication from the World Health Organization. It seems there hasn't been any yet from the World Health body. Priyanshi joining us with the latest on that. Priyanshi, what are we hearing?
Well, Ankita, as you said, the latest on this is that Gambia has recalled these drugs, and there is a door-to-door campaign to find out which houses have these drugs to get them back and to ensure that nobody is having these. Now, this comes in the backdrop of the WHO issuing an alert. They said that four cough syrups produced in India by Maiden Pharmaceuticals are linked to the deaths of 66 kids in Gambia, which is a West African country. And they said that these have contaminants in these drugs, and those are behind the deaths of these 66 people. Now, what has been the response from the Indian government? The Indian government says that the WHO has still not provided us a direct link of whether these drugs were exclusively linked to the deaths of these 16 people. They also say that the WHO should have sent us pictures of these labels if they want to issue any advisory against them, but the WHO has not done that either. The Indian Health Ministry sources are also raising questions on why these drugs were not tested in Gambia. They say that these were exported to Gambia. So any country that imports any drugs has to conduct their own tests before distributing them in that country. So they're saying that why were those tests not conducted there? And if they were, what were the results of that? So those are questions that the Indian government, the Indian Health Ministry is raising to the World Health Organization. But there are also questions that we need to raise to the Indian Health Ministry. Why was this organization, this company given an approval, given a license to produce, to export by the drug controller of Haryana? It's been confirmed by the Indian Health Ministry that they got a license by the drug controller of Haryana. So why was that given if it wasn't safe? That's a question that the government will have to answer. But for now, the government is also saying that the information says it was not used in India, not distributed in India at all, and it was only exported to Gambia.
All right. Thanks very much indeed, Priyanshi, for joining us with those details.